From this week, medical professors start taking 1 day off per week amid their tug-of-war with the government. The health authorities plan to send additional public and military doctors to help fill in their absence. In the meantime, a number of medical schools have announced the sizes of their admissions increases. Our Ahn Sung-jin has the latest.
The government has decided to dispatch public health doctors and military medical doctors to help fill the void left by medical professors and junior doctors. The health authorities are reportedly going to look into the demand by Tuesday and deploy additional medical personnel if need be. While assuring there would be no major gap in medical services, the vice health minister again urged trainee doctors to return to work and professors to remain with their patients, adding that the government has a strong will to talk.
We urge doctors to actively participate in discussions to devise improvement measures. A special presidential committee on medical reform has been officially launched, and the government reaffirms its willingness to engage in one-on-one conversations with doctors.
This comes amid much concern from patients in general hospitals, as medical professors made the decision to take 1 day off from their duties per week. That was decided on Friday at an emergency committee meeting of professors from around 20 major medical schools nationwide. They cited prolonged fatigue after thousands of trainee doctors have been absent from their posts since late February. Professors hinted at the possibility of more than just a day off if the government confirms that there will be an increase in the medical school enrollment quota. Starting this week, the so-called Big Five hospitals will begin to halt medical services 1 day a week, with professors at Severance Hospital and Seoul National University Hospital taking a day off on Tuesdays, while those at Asan Medical Center and the Catholic University of Korea Seoul St. Mary's Hospital will take Fridays off. Professors at Samsung Medical Center will take voluntary days off based on their working schedule. Adding on to its plan to deploy additional medical personnel, the ministry reiterated its plan to inject a total of around $7.5 billion into surgical and internal departments by 2028. As part of such efforts, it unveiled specific plans to improve the working conditions of essential healthcare workers by increasing medical fees for interventional heart disease treatments, which will change starting the first day of June. Meanwhile, some medical schools have made their final decision on their quota increases for the 2025 academic year. Gangwon University and Chungbuk National University will increase theirs by 50%, while the University of Ulsan has chosen to raise theirs by 75%. Though these schools face protests from medical professors and students after announcing their decision, the final number will be delivered to the Korean Council for University Education on Tuesday. Ahn Sung-jin, Arirang News.